I want to start by just highlighting a couple things about sepsis because I think it's not a very common term, and I think it's important to understand exactly what we mean by that. In that, sepsis is really a life-threatening response to an infection that includes end organ injury. So having some organ failure and type of thing associated with infection. Just for those that may not know what that means. And there's a number of factors that would increase someone's risk of having sepsis. A lot of that might have to do with having any risk for infection. So having an existing infection that's not treated, or patients who may have some immunocompromised conditions that might lead to increased infections. And certainly during pregnancy, there are some risk factors that might predispose someone to having an infection, and then they have that response to it. But what we found in our research a number of years ago that I think is really important is that when we looked at it for pregnant and postpartum patients, what we found was that all patients were at risk, and that most cases actually occurred in patients with no risk factors. So I think that it's important in certain conditions that let's focus on those at risk. Let's make sure to educate them about everything. But I think really it's important for sepsis that it is a rare condition, but that many patients who have no risk factors might end up having it. And so I think it's best to educate everyone, all patients as well as providers, to even look at patients they might not seem at risk.